Charlotte, c'est pour vous.
Charlotte, it's for you.
Thank you very much, Sheetal. And thanks for this wonderful opportunity that we have to share our experience of COVID-19 vaccination hackathon in Côte d'Ivoire. So I'm speaking today as a member of the Movement for Immunization Agenda 2030, a global committee of immunization professionals who are seeking to reach the goal of IA 2030 and leave no one behind. So COVID-19 vaccination is very important to us. Next slide, please. So we all know, and it has been established, that with the COVID-19 vaccination came an unprecedented surge in COVID-19 vaccine hesitancy, and even amongst the health workforce, and Côte d'Ivoire was not left out in this situation. That is why in the wake of a national immunization campaign that was planned in December 2021, together with the National Institute of Public Hygiene and the National EPI team in Côte d'Ivoire, in association with the Geneva Learning Foundation and the financial support from Gavi, alumni of the Geneva Learning Foundation's programs came together to try to look for ways to address this particular challenge, because there was a need for health workforce capabilities to be developed, not in the traditional way, but rapid speed was also needed to share lessons learned and especially on how to adapt national guidance to local contexts, not using the existing mechanisms that are primarily vertical. So the question to us was to see how to rapidly strengthen the National Institute of Health, EPI, and partner staff, human resources of health capabilities based on what works ahead of the national COVID-19 vaccination campaign that had as goal to reach 6 million people in Côte d'Ivoire in December 2021. Slide, please. In seven, using our fully digital hackathon country-based scholars, as we call alumni from our programs, they volunteered together with the National EPI to connect over 500 immunization health workers from the country Côte d'Ivoire and also other countries, and they were able to develop 165 context-specific action plans to accelerate COVID-19 vaccination. And it took a number of a series of processes that were fully online. The participants worked in small groups to problem solve context-specific COVID-19 vaccination challenges. And as I said earlier, most of them were related to vaccine hesitancy. Also, they developed action plans focused on local challenges or barriers to COVID-19 vaccination. And they took time to peer review the action plans that were developed by colleagues. And afterwards, based on the feedback received from the action plans that they developed, that feedback received from colleagues, they were able to revise and finalize these action plans and work towards implementing them during the campaign. And so we were able to measure the outcome of these activities via the actual vaccination uptake during the national campaign, and that were matched to the implementation of the hackathon plans. And also, hackathon participants were able to share self-reported implementation, what they were doing on the field, as well as pictures. As you can see on the screen, that is a picture that was shared by a participant who was actually trying to implement his action plan during the campaign. Slide, please. So what do we learn from all of this? One thing, as I said earlier, there was it was owned and led by country health workers across all levels of the health system. And it was a hackathon for Ivory Coast, but they were able to garner, since it was purely digital, participants and peers from 20 other countries. And all of this was developed in 10 days. And at the end of it all, we had 165 peer-reviewed context-specific action plans. most of these action plans, that is were from Ivory Coast, as the 96 of the health districts in Ivory Coast were represented. Over 70% were district and health facility staff, what we call the operational level. And if the action plans were implemented according to the reporting from participants, Ivory Coast participants in the hackathon, they were going to vaccinate an estimated 3.5 million people, that is over 50% of the target 6 million, with a funding gap requiring an additional $0.626 per vaccination. And 71% of participants implemented their action plans during the national vaccination campaign. And 82% were able to reported that they found a solution to better conduct the COVID-19 vaccination campaign through this whole process. And more than 70% said they were capable of using this methodology to solve their day-to-day problems, and also 82% wanted to be able to move forward with that. And so what did we learn from this process? That local solutions, when they are able to integrate them and use them in the campaign to anticipate, prevent, mitigate, and respond to COVID-19 vaccine hesitancy. In my earlier slide, there's actually a quote from a health professional at a district level in Côte d'Ivoire that reported that she was afraid to receive the COVID-19 vaccine, even though she went out on a daily basis to engage and convince people to receive the vaccine, but she was not vaccinated because she was afraid, based on the rumors and the misinformation on social media. So she had to observe over a period of 3 months other people receive the vaccine and be fine, for her to take the courage herself to take the vaccine. After she took it and was okay, she was able to convince others and other family members. She gained more confidence. It came to talking to people about why it was important for them to take the COVID-19 vaccine. So it means that health workers' own confidence in COVID-19 vaccination and their own vaccination status is consistently reported as one of the most important factors in successfully engaging communities. Many a times, the health workers reported they had to present their own vaccination card or a picture of them receiving the vaccine, or a video to get people to receive the vaccine. That is, health professionals are leaders by example. And so there was this countrywide digital peer learning network that connects different levels to foster motivation to share what is learned. So it was digital, it wasn't face-to-face. And so it brought immunization health professionals from the health facility to sit in the same group with leaders at the national level, with other staff working at the national level, and together sharing their experiences on what they are doing to solve concrete challenges that they were facing. And all of these without having to leave their workplace, without having to go face to face, and on a voluntary basis. I'm going to end with this particular quote from a district health director in Côte d'Ivoire that said, during the hackathon, he was able to realize that he had to go beyond traditional methods of engaging the community, that is going to the market, going to the church, places of worship, meeting with associations, to engaging with business leaders. That is those people that have others working with them, working for them, engaging them so that they could reach their staff and their workers. And he said he could not have learned about this without participating in the hackathon. Next slide. All right, so before I conclude, I just want to leave you with these two photographs that are showing all of the different strategies that were developed by the hackathon participants. The first one is a picture of what is called the OWL strategy. That is night vaccination, trying to reach people in the community at the time where they are most available. That was practiced in one of the health districts. And the next one is vaccination sites at the market. That is what has been reiterated throughout this event today, that it's important to meet people with the vaccines where they are. Thank you very much for your kind attention. I'm looking forward to questions.
Thank you so much, Charlotte. Really interesting, and also a lot of the language you're using, and this element of ownership. What does it really mean? Looking forward to Q&A on this shortly. The different parameters and how do you segregate those action plans according to gender, the key barriers, and other challenges from community engagement, and maybe an action plan options for some of our colleagues on the call today. Thank you.
Thank you so much, Sheetal. Those are great questions. And I'll start with the hackathon methodology. First and foremost, it can be deployed offline. So it's most of that is 80% of the participants felt that they were capable of applying that methodology with their teams on an offline basis. And so we're actually focusing on district managers and supporting them to be able to implement that methodology with their team. And also in the last 3 years, we have noticed we moved from 3% participation, less than 3% participation of health facility staff, that is frontline staff, to over 30% recently. And you saw from the slides I showed earlier that over 70% of our participants were from district and health facility levels. So you see that the use of the digital space, internet connectivity, is actually increasing. Finally, I think motivation, you asked about motivation. I think motivation is really the key. And we have seen participants share with us that they had to travel over 400 kilometers to have internet connectivity so they can participate in the sessions. But one thing I'd like to highlight is there is 80% of the work is done offline. 20% is actually online for experience sharing and feedback and all of that. So that is it. And then concerning the question on equity, actually on the parameters, actually this has been done by the Côte d'Ivoire team upon request of the National EPI and the National Institute of Public Hygiene. So the alumni team, that is the group of former scholars of participants in our program, they developed their own evaluation report and worked with the National EPI to review it and identify plans that are most promising. And we are continuing to track the implementation of this plan. And recently, I just learned that the leader of the alumni team has been invited to join the national COVID response planning session that is coming up in Côte d'Ivoire. And Gavi has also reviewed the plan. So perhaps one idea may be to share the lessons learned from this review with partners, if this hasn't already been done or established through the channels that are available. And one thing I also said is, during the hackathon, there were participants from 20 other countries that came to assist. And at the end of it all, most of them were requesting that they would like to have the same thing organized in their own countries. And one example that I can cite here is DRC. So have many other countries that express the need if they could get the hackathon organized to accelerate COVID-19 vaccine uptake. So the only issue is resource limitations. So I hope I've answered all the questions. Thank you.